I'm Arlette Loeser, Program Director and Certified Ergonomist at the Selikoff Centers.
And I'm Michael Gormley, Clinical Nurse Manager at the Selikoff Centers.
In this video, we'll review best practices to help prevent injury while lifting a patient from the ground to a stretcher. After completing your patient assessment and any necessary interventions, providers should first discuss the transfer plan and clearly communicate it with the patient.
Ma'am, I'm going to come behind you. My partner's going to be in front of you. He's going to grab your forearms. I'm going to lift from behind, and we're going to move you into a seated position.
When lifting a patient from the ground, performing a team assessment and establishing clear roles and positioning can greatly reduce the risk of injury for both patients and providers. In dynamic and unpredictable environments, unconventional holds or postures may be necessary. However, the core principles of injury prevention always apply. Start by following scene safety protocols. This includes checking for hazards, managing bystanders, and identifying whether additional help or resources are needed. There are typically 3 methods for ground lifts. 1, direct lift. 2, using a sheet. And 3rd, using a longboard or scoop. Today, we will focus on the direct lift method.
Start by bringing the stretcher as close to the patient as possible and lowering it to ground level.
On your count, let's lower the stretcher to ground level.
1, 2, 3.
Whenever possible, performers lift in 2 stages. First, the provider at the patient's head kneels, then safely raises the patient to a seated position by supporting the shoulders.
Ready? 1, 2, 3.
Second, once seated, both providers reposition for the full lift onto the stretcher.
Alrighty. I'm just going to put my arms just like this, and then we're going to lift you onto the stretcher, okay?
In this lift, the lead provider at the head supports under the armpits, crossing the patient's arms. The second provider at the legs supports under the knees.
1, 2, 3.
Use a squat or kneeling stance, not a bent back posture. This reduces spinal stress and allows for a more secure hold. Avoid twisting during the lift. Engage core muscles to stabilize and support your movement, especially during the transition into the stretcher.
Arm out of reach.
Once the patient is on the stretcher and secured, ensure the path ahead is clear. To prevent drops, always have at least 2 providers with hands on the stretcher while in motion.
And lift you back up, okay? Ready? 1, 2, 3.
When lifting from the ground, clear communication and incorporating micro breaks can help prevent awkward or unsafe postures. These short pauses allow providers to adjust grip, shift weight, and reduce fatigue, supporting safer patient handling. Following these best practices will reduce the risk of injury for both providers and patients.